Pediatric dentist Dr. Melisa Potocki, and from Potocki Orthodontics, Dr. Brian Potocki. Welcome to the show.
Good morning.
Morning.
Thank you. It's the Potockis.
Yes.
How are you guys?
We're good. Yeah. We're happy to be here.
And you guys are married.
We are. Yes. We've been married for 10 years now.
Awesome.
Yeah. That's awesome.
And the fairy tale began at U of M Dental School?
Well, I was an undergrad. Brian was in dental school.
Oh.
Okay.
We met through his sister with the Women's Glee Club at Michigan. And then, yeah, went from there.
That's great. And you guys have developed these practices and worked together. Tell us how it's going so far.
It's growing. It's going great. My practice opened almost 2.5 years ago. Brian has been in the area longer, and it was a great place when we were looking to open our practices and somewhere we could raise our families as well. And we found Grass Lake in the Jackson area. So
that's awesome.
Yeah.
And you have kids already?
We do. We have 3 girls.
Oh my goodness.
Wow.
Yep. Girl dad. How's that for you?
Honestly, it's great.
Yeah.
You know, I didn't know what to expect, I don't think, but I love it. So yeah.
That's cool. Parents have so many questions related to pediatric dentistry and obviously orthodontics. What age is good? Well, I'll start with you, Brian. What age is good to first maybe come see you?
Yeah, the American Association of Orthodontists recommends everyone get screened by or around age 7.
Okay.
So honestly, it's relatively rare that we have something that we need to do at that young of age, but there's a non-zero chance that you have something going on that we can intercept early. Sure. And so it's worth it just to do the screening. So I always tell people, like, I'd rather see you and say, it looks great, we don't need to do anything, as opposed to like see you later and be like, man, I wish I would have seen you sooner. So.
And you guys are casual and comfortable and offer consultations.
Yeah, the consultation doesn't cost anything. I mean, obviously time, to come and see me, but money-wise, it doesn't cost anything. And then you just know if it looks good, we can wait until we're older, and if it's something that we need to do, we'll talk about that. So.
And you were in the Air Force.
Correct. Yeah, I did. I did a scholarship program through the Air Force, so they actually paid for my dental school, which was obviously great, and then did some training with them, and then was stationed in New Mexico for a couple years working as a dentist out there. And then after the Air Force, decided I was, not done. Both of us, we weren't done with school, so we went back to our residency programs after that. So, yeah.
Now, do your practices, like, do they complement one another? So your pediatric dentistry patients that might end up being patients of Brian's as well? Yeah,
yep. So I'm always screening and looking at every exam for a child's growth and development, not just cavities. So if there's something that I'm concerned, or even I just want something him to take a look at, he's the expert at growth and development, so I usually send them over to him.
Yeah. What's good? What are some good tips to take care of your child's teeth? It's like the hardest thing to do, getting your kid to brush their teeth and take care of them. What are some good tips and tricks for keeping an eye on those kids?
So the number one thing that I tell most parents is kids don't have the hand skills to brush well on their own until they can tie their own shoelaces. So until they can do that, they often need more supervision and help than what we might realize. Making it fun, letting them brush first, and then either a toothbrush they're excited about, or doesn't always have to be a fancy one, but singing a song while you're brushing, and role modeling is important. But kids usually need a lot more help with brushing for a little bit longer.
Yeah.
The Jeopardy song is good for toothbrush.
Is it?
Yeah.
We have some.
Is it 2 minutes?
We have some pictures you brought along of the staff. Here's some of the team.
Oh, big staff.
This is a good-looking team, and I have to compliment the shoe game. It looks like everyone has purchased Jordans.
The ones in that picture, those are actually Dunks.
The Nike Dunks.
Those are custom Dunks that we got because
nice.
That was a gift I gave to the team. So
that
we
was
all got
nice of you. Well, we'll go to the
ones.
shoe cam right now and show the Jordans that you're wearing anytime anyone's wearing any.
Yep.
You got to match the branding,
yes,
of course.
Yep. Yep. I like to.
He probably gave him the shirts too.
Well, I got to tell you, if you custom did all those dunks, you were a very, very nice boss.
They were excited about those.
bet.
So, and they actually have their names on the back of them
Oh,
too.
that's cool.
They have like the little embroidery.
That's
so,
awesome.
Yeah.
Now, we didn't get to meet the dog today.
No.
3 girls and a dog.
Yes.
This is the office dog.
The dog is a boy. So,
Oh,
Yes.
yes, three girls. and
What
a-
is the dog's name?
That's Brady.
Brady. And Brady's at the office every day?
He is. Yep. He's a registered therapy dog, so he comes to work every day and he's there for the patients and oftentimes more so their parents
Yeah.
and the team too.
Are parents
so.
more nervous than their kids sometimes?
A lot of times,
Yeah.
yes. Yeah. As a parent, I understand.
Yeah.
So.
Well, I think for a pediatric practice to have a dog there, it just
That's
helps to get the kids more comfortable with seeing the dentist.
Yep.
I saw a story yesterday. The pouch, the baby food pouch. It's people are buying them for their kids after they're not babies anymore, and it's causing some issues. Are you seeing anything?
You talking about like the go-go squeezes?
Pouch, baby food pouches.
Yeah.
I gotta tell you, I've had some. I eat those
You eat those
applesauce
too?
when I'm walking
They're
by.
easy to
As
go.
you have.
Yes,
Yeah,
yep,
they're
yep.
easy on the
They're
go.
easy there.
Yeah.
Yeah.
Yeah, and most kids, that's not all they're eating. They're still eating and chewing, and
Yeah.
so unless they're doing that all the time, shouldn't be issues with it. But
They're not going to not learn to chew.
correct.
We had hockey people on the other
Yes,
day.
we did.
Try hockey for free. I asked how
Oh yeah.
young, and they said as soon as they can walk.
Mm-hmm.
But I would suggest they have a dentist before they try hockey.
Sure. And I don't think you need to wear mouthpieces anymore for hockey either. So
Oh, I mean, that's hockey pucks, teeth.
you got to be careful.
You gotta be.
Yeah.
careful.
Yeah.
You got to be
We
careful.
can make those too.
What's the most rewarding part? I'll ask you both. What's the most rewarding part of your job?
For me, it's just we get to see patients for 2 years, usually. I would say 18 months to 2 years, and seeing often it's a time in their life when they're transitioning and getting older, and just, it's great that they look different and their teeth look really nice, but to see the confidence change in
Right.
people, even in adults who aren't growing, if you can make their teeth look nice and they can go out and interact with the world differently than they did before because that confidence that they have, and they can tell us about it. That's it doesn't get any better than that, So
Ella has a classmate. He's got some sort of thing going on, with 40 rubber bands in his mouth. Is it really hard, especially that age, middle school, high school, taking care, of the orthodontics, whatever that is? in your
yeah,
mouth?
that's probably one of the number one things that we talk about too. Is it's not worth it. The braces aren't worth it if you're going to have a bunch of cavities afterwards.
Right.
So you got to keep them clean. I give everybody who starts with me a water pick because asking a teenager to floss at all is probably a difficult sell, let alone flossing with braces where you got to thread it through each time. So it can be tough. The rubber bands can be a little bit tough, but they get good at those. If you're especially girls, if you can put your hair up, you can do the rubber bands pretty easily. Teenage boys are tougher generally, but they get through. But yeah, I mean, keeping it clean is harder. Braces are hard to keep clean, and so we try to focus on that, with making sure everyone knows how important that is.
You guys have philosophies for your practice. Tell us a little bit about your, how you approach pediatric dentistry.
Well, also, I think the best part of my job is I'm hoping to create someone who values their dental health for the rest of their life, and also someone who's not afraid of the dentist. So that's a priority for me. Dental health, obviously, number one, but also having a positive, good relationship with going to the dentist, because it can be tough sometimes. So for me, I offer lots of different things to help with that, including Brady. Having parents there and in the room always.
Oh, that's nice.
And then options for sedation, TVs on the ceiling, all of that. So.
Nice. And you have a philosophy for orthodontics.
Yeah, I tend to be open communication is a big deal for me. So we, when you come in for your new patient exam, like I take a scan of everyone's teeth, digital scan. It's a cool technology. If you haven't had it, we don't do impressions anymore. And I have a big screen in the office, and so everyone can see their teeth, blown up on a 55-inch screen, and I can move them around and say, like, this is exactly what I'm going to do for you and why it's important for your health going forward, or aesthetics. And so conservative treatment. I don't treat young kids, again, like I talked about, if they don't need it. I screen them, but I don't do a ton of early treatment, they call it. And then just open communication with an understanding of what it is that we're going to do and why we're going to do it. And I think that really is, my, probably encapsulate my philosophy pretty well. So.
Well, we want to thank you both for being with us this morning, and thanks for helping us, sponsoring JTV Sports and the David Rice Show. We appreciate your partnership.
All
Yeah,
right.
thanks
Thank
for
you guys
having
very
us.
much.
Mhm.
Doctors Melisa and Brian Potocki from Potocki Orthodontics and Grass Lake Pediatrics. We'll be back with more of the show right after this.